So we have many different ways of helping your cervix soften and open during this stage of the induction. One of those is Dilapan. Dilapan are soft gel rods that are gently inserted into the cervix and act a little bit like a tampon would in that they absorb fluid and therefore expand. So what happens is they start off very, very thin and very, very small, and they absorb the fluid from the surrounding cervix and vagina, and they slowly, over a 12-hour period, expand to become bigger. This opens up the cervix, but also helps stimulate natural prostaglandins. So prostaglandins, as Caroline explained, are a natural hormone that's job is to start softening and opening the cervix. So these soft gel rods, anywhere between 3 and 5 of the soft gel rods, are inserted gently inside the vagina by a midwife or a doctor. This is usually done under speculum examination or just by using our fingers. And they remain in place for approximately 12 hours, after which time they are removed. Some people find it a bit uncomfortable when the rods are first inserted, so it's really important that you practice that big deep breathing that Caroline talks about, in through the nose, out through the mouth slowly, keeping the jaw nice and soft. Once we've removed the gel rods after 12 hours, we'll assess the cervix again. If the cervix now has that Bishop score of more than 6, it means we can move on to the next step of induction of labour. If the cervix has a Bishop score still of less than 6, there are other things that we can be doing in order to help the cervix soften and open. It might be that we need to put the Dilapan rods back in again, or we can use synthetic prostaglandins in order to help the cervix soften and open. Another form of medication that we can use in order to soften and open your cervix is something called Propess. Propess is a medication, is a synthetic prostaglandin on essentially it looks like a thin flat tampon, and that's placed next to the cervix and slowly releases prostaglandins over about a 24-hour period. During that time, some people can get cramps, backaches, period type pains as the prostaglandins are working on the cervix. After 24 hours, the Propess will be removed and your cervix will be reassessed for the Bishop score. Again, if the Bishop score is over 6, we can move on to the next step. If the Bishop score is still less than 6, there are other methods that we can use. We also have something called Prostin that's administered vaginally either in a pessary form or a gel form and put onto the cervix. This is administered every 6 hours until either contractions have started or the cervix has dilated to the point we can move on to the next step, so the Bishop score is more than 6. There's a maximum of 3 doses we can administer of the Prostin, and the doctors will be involved in your care after dose 2 to discuss with you what your options are. With all forms of synthetic prostaglandins, so the Propess or the Prostin, there is a risk of what's called hyperstimulation. This is where your body reacts quite quickly to the medication we're giving you and the contractions start quite strongly and quite quickly. This is not ideal, and we like to slow labour down either by taking the Propess out or removing the pessary, and we can even give you a medication to slow contraction down if necessary. At any point during the induction of labour process, your contractions may just start. If this is the case and you've gone into labour, then you'll be transferred from St Catherine's ward to delivery suite for appropriate intrapartum care. The softening and opening part of the induction of labour will take place on St Catherine's ward. So I'm briefly now going to talk about what to expect on St Catherine's ward and ways of helping yourself while you're there. You'll be in a bay with other women who are being induced, and the other women will be at varying stages of their induction. So never compare yourself to the other people around you. Some people may come and then move on quicker than you, but everyone responds differently to induction of labour. And while sometimes induction might take a couple of hours for one person, for another person, it may take a couple of days. You can have your birthing partner with you, and your birthing partner can stay with you all day during the induction, but we do encourage them to go home overnight if you are not in labour. Of course, they can come back in if you do go into labour during that time. You'll get 3 meals a day for you, but not for your birth partner, so make sure that they're bringing in their own food and snacks. Also, while you're on the ward, it can be noisy, it can be a bit bright, and if we're trying to get you to rest and relax overnight, that can be tricky. So please make sure you bring in your own pillows, eye mask and earplugs, and let the midwife know if you're using the earplugs in order to aid you to rest overnight. Pain relief wise on the ward, we have multiple different things that we can offer you. You can hire a TENS machine from the physiotherapy department at the Royal Surrey in advance of your induction of labour, or you can bring in your own maternity TENS machine if you choose. And there's more details about how to hire a TENS machine and the benefits of a TENS machine in your pack. Sometimes the induction of labour process will cause backache or period-like cramps, and these can be a bit uncomfortable. So we have forms of pain relief to help you. We can offer you paracetamol, something called dihydrocodeine, or an injectable form of a drug called pethidine. You can also use any hypnobirthing skills you've learned, deep breathing, affirmations, and anything else to help manage your pain or discomfort during this time. If you are in lots of pain or discomfort, please make sure you tell a member of staff and we can make sure we get the appropriate treatment for you. During your time on St Catherine's ward as well, you'll often meet lots of different people. So you might meet maternity support workers, you might meet some of our midwives obviously, and even our obstetricians who will be part of your care because you'll be considered consultant-led. That means the doctors help us plan, implement your care, but the majority of it will still be given by the midwives on the ward. While you're on the ward as well, we'll be doing extra checks on you and the baby. So you'll be having heartbeat tracings of the baby multiple times a day, as well as offering you things like temperature, blood pressure, pulse checks, feeling your tummy, doing an abdominal palpation, and offering vaginal examinations if and when they're necessary to ascertain the stage of your induction and whether you're ready to move on to the consultant-led delivery suite. Please watch the next video about releasing waters and how to stimulate contractions.